Bowel cancer is a very common disease. 38,500 people are diagnosed with the disease annually, more than 100 people every day. We are, as a consequence, trying to raise awareness of the disease with Bowel Cancer Awareness Week, trying to draw attention to screening and trying to protect people from developing the disease.
Colorectal cancer is principally a disease of advancing age, so something in the region of 8 out of 10 patients who have colorectal cancer will be over the age of 60. That's simply because you've been around long enough, if you like, to develop the genetic problems that develop into a cancer. But there is emerging evidence that the younger population of patients with colorectal cancer is growing. So I think the message is, whatever age you are, if you have worrying symptoms, then I think you need to go and seek advice. One of the problems is that symptoms of colorectal cancer are often unreliable. Many patients will have colorectal cancer without any symptoms, and then another big group will have symptoms that present very late, and therefore at that stage the disease is not curable. Nevertheless, it's very important to look out for the symptoms, and the sorts of alarm symptoms that we worry about, first and foremost, is a change in bowel habit. What we mean by that is that you normally have a regular pattern, so if that regular pattern changes in any way, typically to increased frequency, so going more often, and an increased looseness of stool. Bleeding is another one. The trouble with bleeding is that bleeding can simply be hemorrhoids or something very simple, but it can also herald colorectal cancer. And again, not worrying about single episodes often, it's sustained pattern of bleeding over a period of time. The research undertaken by the London Clinic suggested that 50% of patients, even if they had rectal bleeding, wouldn't go and seek advice about it from their GP, knowing that there might be a problem. And about 1 in 10 patients will be too embarrassed to talk about any of their symptoms, even to sort of close family members. But it really is very important, if you develop those symptoms, to think about going to seek advice from a healthcare professional.
There are various lifestyle measures which may reduce the likelihood of developing colon cancer. A diet which is rich in fruit and vegetables may be of benefit. Reduce the amount of red meat in our diet may be of benefit. Taking a regular daily aspirin has been shown to reduce the risk of developing polyps, and it may also give you some benefit against colorectal cancer. Screening for colorectal cancer is targeted at those who do not have symptoms, because we're trying to detect early lesions which will develop into colorectal cancer, a thing called a polyp, and remove them. Then that gives at least an 80% reduction in the risk of subsequently developing colorectal cancer.
There's been significant improvements in outcome or survival over the last 10-20 years. You're not only able to diagnose, but you can also treat down the endoscope, so remove polyps, look at tumours, and the whole business of minimal access surgery, keyhole surgery being applied to colorectal cancer, and then aspects of oncology, so that the chemotherapy that's available has dramatically improved, and radiotherapy as well. And the message to the patients has to be that if you notice any alarm symptoms, the symptoms we've discussed, it must prompt a visit to your healthcare professional.